A seizure can be defined as a sudden synchronous discharge of neurons which leads to symptoms and signs. But what are seizures? To understand a seizure, we first must look at how the brain works. The brain is made of thousands of neurons which interact with each other. Normally, the interactions are balanced. However, disruptions can cause the neurons to misfire, which can lead to uncontrolled muscular spasms. However, the extent of the symptoms depends on the area of the brain that the neurons are misfiring in, and people can often feel a seizure about to happen. This is known as an aura. A device called an electroencephalogram is used to monitor these interactions. Seizures are generally divided into two main groups: partial seizures and generalized seizures. With partial seizures, the electrical discharge occurs in a certain part of the brain. There are two subtypes of partial seizures, known as simple and complex partial seizures. The main difference with them being that in a simple partial seizure, the patient is aware, while in complex, the patient loses awareness. An example of a partial seizure is a Jacksonian seizure. They normally occur in the motor cortex and lead to jerking in one hand or one side of the mouth. Complex partial seizures usually occur in the temporal lobe or the frontal lobe. With generalized seizures, the electrical discharge happens in all areas of the brain at the same time, and there's always a loss of either awareness or consciousness. There are several types of generalized seizures, the first of which are absent seizures, in which the patient will lose awareness and have a vacant expression, staring to the distance for about 10 seconds, before rapidly returning to normal, and often they do not remember it happening. The second group are myoclonic, tonic and atonic seizures. Myoclonic seizures are brief jerks of muscles which lead to involuntary spasms or twitching. With tonic seizures, the patient's muscles stiffen and do not jerk. Atonic seizures are the opposite of tonic in that the patient's muscles go limp, causing them to collapse to the floor. The third type of generalized seizures are tonic-clonic seizures, in which the patient will stiffen up and then begin to jerk their limbs. It normally lasts for about 2 minutes, after which the patient will be unconscious and gradually return to awareness. It is common to experience confusion and headaches afterwards. Epilepsy and seizures are not the same thing. Epilepsy is a disorder that's characterized by recurring seizures and can also be known as a seizure disorder. The seizures I've been discussing are known as epileptic seizures, as they all involve some electrical disturbances in the brain. However, there are some seizures that occur without electrical disturbances. These are known as non-epileptic seizures or dissociation seizures. They're divided into two types: organic non-epileptic seizures and psychogenic non-epileptic seizures. Organic non-epileptic seizures have a physical cause, such as blood sugar, and can lead to fainting. Psychogenic non-epileptic seizures are caused by emotional or mental processes. This can occur after a traumatic event, such as an accident or the death of a loved one. Thank you for watching today's video. If you have any questions, please leave them in the comment section below, and don't forget to subscribe to get more videos. I hope you have a great day.